Welcome to the Deep Dive. Today, we're plunging into a topic that, well, you've probably heard of, maybe even feel a bit wary about, MRSA. For a lot of us, it just screams hospital or maybe some kind of physical danger. But there's often more to the story, right? A whole hidden side. So our mission today is to really unpack what MRSA actually is, yes, but then to go further, we want to explore that significant, often unseen psychological impact it can have. And then we'll look at how we manage its spread comparing hospitals to, our own homes. We've got some really insightful research and reports to guide us.
Exactly. And it's so important because it's not just about the bug itself. It's about what people go through when they encounter it. We've looked closely at the material you mentioned, focusing on those nuances, the psychological effects, the different prevention tactics. So maybe starting with the basics, MRSA. It stands for Methicillin-Resistant Staphylococcus aureus. Essentially, it's a type of staph bacteria, Staphylococcus aureus, but this one has, well, it's evolved. It's resistant to several common antibiotics.
Like methicillin, obviously, and penicillin-type drugs.
Precisely. Yeah. And that resistance is what makes it particularly challenging to treat sometimes. Yeah, something the research really stresses is the difference between colonization and infection. This is key. Colonization just means the bacteria are living on your skin, maybe in your nose, but they're not actually causing any harm. No symptoms.
Just sort of hanging out.
Pretty much.
Yeah.
Some estimates suggest around maybe 2% of people carry it like this.
Yeah.
Totally unaware. An infection, though, that's different. That's when the bacteria start causing problems, a skin infection, maybe a wound gets infected, or even more serious things like pneumonia or bloodstream infections. That needs treatment.
Okay. And the sources also frame MRSA as a kind of poster child for HAIs, right?
Yeah.
Healthcare-associated infections.
It's like a good way to put it, yes.
Yeah.
It's probably the most well-known HAI, but it's definitely not the only one.
Yeah, the research mentions others like C. diff, infections from catheters or surgery,
Yeah.
even ventilator-associated pneumonia.
Right. CLAB-SI, CIUT, SSI, VAP, lots of acronyms. But the point is, MRSA fits into this bigger picture of infections acquired in healthcare settings.
And understanding that context is important because the psychological stuff we're getting into, it's not just an MRSA issue.
Exactly. That's a crucial point the research makes. The psychological burden is often tied to the experience of having an HAI, especially if isolation is involved, not just the specific bacteria. Which brings us to the core of that hidden toll. Historically, the focus was so much on the physical side.
Yeah, like morbidity, mortality, how long you're in the hospital, treatment challenges.
As all critical things, obviously.
Yeah.
But there's this growing recognition now of the huge mental and emotional weight these infections carry.
Okay, so let's dig into that because the findings here are, well, they're pretty striking. Studies looking right at MRSA patients found this clear link between getting that diagnosis, especially if it meant isolation, and some really tough emotions.
Yeah, they did. Studies showed isolated MRSA patients had significantly higher levels of depression and anxiety compared to patients who weren't isolated.
Wow, significantly higher.
Yes. And other research also found increased anger in those isolated patients. It suggests that physical separation has real emotional consequences.
And then there are the qualitative studies where they actually talk to patients. That's where it hits home, I think.
Absolutely. The words patients used. Feelings of guilt, anger, frustration. Feeling contaminated, stigmatized, deeply alone, ashamed, confined.
Those are powerful words, things we don't often associate with, a bacterial infection.
Exactly. And stigma is a recurring theme. The research shows that even just carrying MRSA without being sick can lead to poor mental health because of how people perceive it. There was a Dutch study mentioned. It found a substantial link between feeling stigmatized and having worse mental health. And this isn't just hospital stuff anymore, with community-associated MRSA spreading outside healthcare.
Right, CA-MRSA. So the psychological impact follows it out into the community, too. And you said this isn't unique to MRSA. The research connects these feelings to other HAIs as well.
Definitely. Especially with isolation. A big review looking across different studies, different resistant bugs, it found the same pattern. Isolation consistently linked to more depression, more anxiety.
It makes sense, doesn't it?
It does. And some of the descriptions from patients are just harrowing. People talking about strained relationships with doctors, feeling shame or guilt, fear, anxiety, especially if they felt staff were keeping their distance. Patients use phrases like feeling dirty, like having the plague, or feeling like a leper.
Gosh, like a leper. That's intense.
It really is.
Yeah.
And these feelings didn't just vanish when they left the hospital. They affected relationships, work, everything. Similar findings came from studies on C. diff patients too. Lots of psychological distress, worry about future hospital stays, anxiety about staff hygiene. It underlines this is a common thread with HAIs.
Okay, so why? What's driving this connection between these infections and such difficult psychological effects? What did the sources suggest?
Well, there are a few layers. On a basic level, we know chronic illness in general increases the risk for depression and anxiety. There's the stress, the impact on quality of life.
And a persistent infection like MRSA or the long haul after a serious HAI definitely counts as chronic stress.
For sure. But then there's a biological angle too, related to inflammation. Chronic infections mean chronic inflammation. And the research talks about how the chemical signals involved in inflammation cytokines can actually affect brain function, mood regulation, potentially leading to depressive symptoms.
Interesting, like the body's response to the infection directly impacting mood.
Potentially, yes. And related to that is something called sickness behavior.
Sickness behavior.
Yeah, think about when you're sick, you might withdraw, lose interest in things.
Mm.
The research suggests these inflammation-linked cytokines might mediate that. Initially, it might be adaptive, conserving energy to heal. But if that withdrawal goes on too long, it becomes psychologically damaging.
And it's not always just the infection causing the distress, is it? The research mentioned it can go both ways.
Right, a bidirectional relationship. The infection triggers distress, but someone's pre-existing mental health can affect how they cope. Depression itself can lead to withdrawal, creating a vicious cycle.
So what makes someone more likely to experience this withdrawal or depression after an HAI? Did the research identify specific risk factors?
It did. Several things came up consistently. Pre-existing mood disorders are a big one. Lower income, having other chronic illnesses, lack of good social support.
Makes sense. The usual suspects for vulnerability, maybe?
To some extent, yes. Plus, the stress of the diagnosis and treatment itself. And having depression beforehand seems to increase the risk of PTSD after a really severe infection, like sepsis from an HAI that lands you in the ICU.
And isolation itself, obviously.
Isolation itself, absolutely.
Yeah.
Also, the severity of the physical infection matters. And then there are the factors linked directly to the experience. Feeling stigmatized, feeling like you weren't giving clear information, noticing less staff interaction, sensory deprivation and isolation, plus those feelings we talked about, shame, guilt, fear of spreading it, feeling unclean, loss of control, loneliness, boredom, frustration, anger, all tied to psychological distress. It's complex.
Let's focus on isolation for a moment. It's such a common tool for MRSA in hospitals. What did the research say specifically about its impact?
Well, the findings are pretty clear measures, like fewer visitors, less staff time, disrupted routines. They take a significant toll on mental well-being.
We mentioned the higher depression, anxiety, anger scores already.
Yes. And the potential for sensory deprivation, even abnormal thoughts, with prolonged isolation. It's not a benign intervention, psychologically speaking.
And you mentioned that detail about healthcare workers potentially spending less time with isolated patients. That must feel awful.
It really exacerbates the feeling of neglect, of being cut off. It's understandable from a workflow perspective, perhaps, but the impact on the patient is undeniable. And critically, the research highlights that not understanding why you're in isolation is a major source of distress. Clear communication makes a huge difference.
The personal stories included in the material really drive this home, don't they? They put a human face on these findings.
Absolutely. Like Annalie Barclay's experience with chronic MRSA, the severe depression, anxiety, shame, the isolation she felt. It wasn't just a physical illness for her. And it affects families, too. Parents of kids with MRSA describe feeling isolated by others, changing how they socialized out of fear, a kind of ripple effect of withdrawal.
And Natalie's story, recurring HAI-related MRSA, forcing her to close her business, limiting her social life. It shows the long-term practical consequences of this social and psychological impact.
It really does. And that historical reference, patients feeling treated like lepers, it underscores the potential depth of that stigma and withdrawal.
You know, the fact that support networks like the MRSA Survivors Network even exist highlights the ongoing need, doesn't it? People struggling with that loneliness and isolation long after the acute phase.
It's powerful evidence, yes. A clear sign that psychological support is essential. Okay, so let's switch gears a bit now to prevention and control. The source material specifically compares home versus hospital settings, which is really interesting.
Right. Let's start with the common ground. Basic hygiene seems crucial no matter where you are.
Absolutely fundamental. Frequent hand washing, soap and water, or alcohol rub, and doing it thoroughly for long enough That's non-negotiable.
The old happy birthday twice rule.
Still a good guide.
Yeah.
Plus, keeping wounds clean and covered, disposing of dressings properly, and really importantly, not sharing personal items, towels, razors, toothbrushes, and using barriers on shared stuff like gym equipment. Universal advice.
Okay, so what about prevention specifically at home? What does the research recommend there?
Beyond the basics, it gets into things like regular showering. Laundry practices are highlighted using the hottest water safe for the fabrics, maybe using bleach, washing things like towels, and bedding separately. Even ironing is mentioned sometimes. Cleaning focuses on high-touch surfaces, doorknobs, counters, remotes. Using disinfectants known to kill MRSA, following the label directions the EPA list is a good resource mentioned. Wiping down equipment that can't be washed.
What about wound care at home?
Following your doctor's specific instructions is key. Avoiding touching other people's wounds or dressings. Using gloves if you're helping someone. And then there's decolonization sometimes recommended for carriers. Using special nasal ointments or antiseptic body washes like chlorhexidine or even carefully managed dilute bleach baths, under medical guidance, of course.
Bleach baths. Wow.
Yes, specific protocols exist for that. But the key is medical supervision. Also crucial at home. Educating everyone living there, telling your doctors about your MRSA status, and seeking help quickly if an infection seems to be starting or worsening.
Okay, now let's contrast that with the hospital. Sounds like things get much more intense there.
Definitely more rigorous, more protocol-driven. Contact precautions are pretty much standard for known or suspected MRSA.
Meaning gowns and gloves for staff every time they go in the room.
Every time they enter or touch the patient or their environment. Plus clear signs on the door. That's a huge difference from home.
And isolation.
Isolation in single rooms or grouping MRSA patients together, cohorting, is very common. The goal is always shortest duration possible, remembering that psychological impact, but it's a standard tool. Again, not something you typically do at home. Hospital cleaning is on another level. More frequent, much more rigorous, using hospital-grade disinfectants. Sometimes they even use UV light or hydrogen peroxide vapor as extra measures. And they monitor how well the cleaning works. Shared equipment is strictly disinfected or sterilized.
And screening. I hear about that sometimes.
Yes, systematic screening of high-risk patients on admission is common practice in many hospitals. And decolonization protocols, nasal ointment, chlorhexidine washes are applied more systematically, often with follow-up tests to see if it worked.
And PPE for staff is just routine.
Gowns, gloves, routine, sometimes masks or eye protection depending on the situation. Staff education is very detailed on all these protocols. Hospitals also have broader strategies, surveillance programs, risk assessments, ongoing staff training, ensuring supplies are available, managing patient movement, clear communication during transfers, teaching about early sepsis signs, and really importantly, antimicrobial stewardship, making sure antibiotics are used wisely.
So, summing up the key differences from the research. Contact precautions and isolation are hospital standards, not home ones. Cleaning is way more intense in hospitals. Screening and decolonization are more systematic. Routine PPE for staff in hospitals, not really for home caregivers. The focus of education is different too.
Exactly. It really drives home the point that prevention strategies have to be tailored. What's necessary and feasible in a hospital just isn't the same at home.
Which makes perfect sense. You need the right tool for the job, essentially.
Precisely. And looping back to the psychological side, the research makes strong recommendations based on these findings. Addressing the psychosocial effects has to be part of the plan. For healthcare providers, this means things like proactively identifying patients at higher risk, maybe screening for mental health history. Clear, empathetic communication is vital, explaining the infection, why isolation is needed, the treatment plan. That can really reduce anxiety.
And trying to lessen the blow of isolation?
Yes, actively finding ways to do that. Facilitating safe interaction with staff and family, ensuring access to phones or tablets, making sure mental health support is actually available and offered. Educating staff not just on procedures, but on the psychological impact of HAIs and isolation, and how to offer emotional support. Tackling stigma within the healthcare setting itself.
Making mental health support easy to access, not an afterthought.
Exactly. And potentially monitoring patients long-term, especially after severe infections.
And what about recommendations for patients themselves, based on the sources?
The key message is, speak up. Communicate openly with your doctors and nurses if you're feeling sad, anxious, isolated. Reach out to family, friends, or look into support groups like that MRSA Survivors Network. Use the mental health resources available. Practice self-care as much as possible. And importantly, understand that feeling distressed is common in this situation and help is available. You're not alone in feeling that way.
That's such an important message. It's okay to not be okay.
Absolutely. And one final point the research touches on is the long-term nature of some of these effects. The psychological impact doesn't always end when the infection clears. Especially after more severe infections, people can experience ongoing anxiety or depression.
Like post-sepsis syndrome you mentioned earlier, which can follow severe HAIs and includes things like depression, anxiety, even PTSD.
Right. And untreated mental health issues can have lasting effects on overall health and social well-being. It
Hmm.
really reinforces the need for that holistic, whole-person approach to care.
So, wrapping up this deep dive, it's clear MRSA and other HAIs aren't just physical fights. They carry this potentially huge psychological weight withdrawal, depression, anxiety, often tied up with isolation and stigma. And preventing spread looks really different in hospitals versus homes, needing strategies tailored to each specific place. Support and communication seem absolutely key throughout.
It really underscores that effective infection management has to include psychological well-being. You can't separate the two.
Which leaves us with a final thought, something pulled right from those patient experiences in the research. Knowing that people with HAIs like MRSA often feel stigmatized, ashamed, even treated like a leper, how does that challenge us? Challenge all of us healthcare folks, community members, just as people to educate ourselves better and interact with more understanding and compassion, whether someone's in a hospital bed or just living down the street. Thank you for joining us on this deep dive. We hope it's giving you some valuable insights and perhaps something important to reflect on.